So guys, happy Thursday. Cold one. That hot chocolate weather. Don't get it too often down here. Oh, Las Cruces, New Mexico. Anyways, good evening, everyone. I'm Dr. Joaquin Acosta, your host for tonight's Know Your Pharmacist Livestream and the CEO of Farm True. Welcome to a journey where we fuse innovation with compassion and where every insight we share is a step towards a healthier tomorrow. Tonight, we delve into a pressing issue shadowing our communities, the rise of pharmacy deserts. This is more than a challenge, a call to action for all of us in the healthcare sector. We'll explore how these deserts are forming right before our very eyes and the systemic changes needed to bring life-sustaining resources back to these areas. Then, we shift our focus to the cutting edge of healthcare technology. Imagine a world where managing diabetes is transformed through continuous glucose monitoring, a world where technology is not just a tool, but a companion in your journey. And guess who's fulfilling those needs and billing your insurance for it? Best Buy, not just the future, this is now, and we're going to explore it together. Our Enlightenment Hour today takes a creative turn. We'll unpack the science behind the Wim Hof method, exploring how simple yet profound practices can unlock superhuman potential within us all. But harnessing the power of the mind to achieve what once seemed impossible. In our Herbal Wellness Corner, we stand at the frontier of medical innovation with cannabinoid microdosing. Not just a treatment, it's a beacon of hope for Alzheimer's patients and their families. We're here to share how small steps can lead to giant steps in healthcare. We'll also shine the spotlight on the Posta De Mesilla culinary gym that's more than just a restaurant. It's a story of heritage, community, and the power of good food to bring people together. And finally, in our Men's Health Minute, we're here talking real talk. We'll dive into the Cleveland Clinic survey dissecting the current state of men's health in America. It's time to confront the realities and break the stigmas surrounding men's health. So buckle up, my friends. Tonight, we're not just sharing information, we're igniting a movement towards a world where health is not just a privilege, but a right for all. Let's learn, grow, and transform together. So know your pharmacist. Let the journey begin. So, starting this thing up, guys. Lots to unpack in the Pharmacist Frontline segment because what we're looking at is pharmacy deserts, right? And looking at this has actually been something that's been culminating since even already COVID. Pharmacies, big box chains started backing out of, your socioeconomically challenged communities. And that's the frustrating thing because now all of a sudden we're looking at 2024 with all sorts of headlines where this is still a thing. They're backing out of certain particular areas, African American, Hispanic based, very centralized in those large metropolitans on top of, in the states that have rural communities, and they're just, not even available there, pushing people to mail order, not having pharmacists available, in person for patient care or the pharmacy. So when you really think about those kinds of things, mail order is also fun and games until you need a stat medication, right? Or you need a change, or you're out of refills, and you can't wait a week for something to come in the mail, inclement weather or something like that. You're already doubling down on the amount of risk in the supply chain by having to put something in the mail versus going to just go pick it up from the pharmacy yourself, right? And coordinating that, getting done. However, and this is not to beg the question and sit here and race bait anything. It's just interesting that the studies truly have shown, wider dense neighborhoods have not, suffered the same sort of thing. Anyways, first thing, headline here you're seeing today. This is why I'm questioning, bringing even more conversational light back to the pharmacy deserts, because there's a couple things looking at pharmacy headlines for today, guys. CVS to close select pharmacies in Target stores in the coming months. Obviously just more closures from CVS, something we've been expecting. And then another one, looking here, another Walgreens closes in Roxbury, raising concerns of pharmacy deserts. Looking at this, Roxbury, this is Boston. 3 Walgreens closed within a week of 2022 in predominantly Black and brown neighborhoods. The Warren Street Walgreens is set to close on Martin Luther King Jr. Day. Walgreens is closing one of its locations at 416 Warren Street in Roxbury. Looking at it, right? Walgreens Roxbury is reportedly set to shutter by Monday, which will mark the pharmacy giant's fourth closure in majority Black and brown neighborhoods in the city in recent years. Residents protested. This is crazy too, right? You've got pharmacists protesting not wanting to work there, and then you've got residents protesting the fact that they're closing. Like, how big of a problem is this really? Like, think about that, guys. Crazy. And then, right, protesting in Boston's Roxbury neighborhood, which also lost to Walgreens in late 2022. Two other locations, Hyde Park and Mattapan, also closed that week. Roxbury, it's more than 45% in Black and 28% Hispanic or Latino demographic data shows. The same data shows that 44% of residents don't have access to a car. Residents looking for the nearest alternative may face tough commutes. The closest Walgreens is on Columbus Avenue, which is about a 22-minute walk from the Warren Street location. The CVS on Dimmock Street is also about a 20-minute walk. Back in 2022, Boston City councilors raised concerns about creating pharmacy deserts in neighborhoods. And this is interesting, right? Because we've looked at this on the bigger scale where state contracts are getting eaten up. Independents are shutting down because they can't afford to take care of PBMs. Independents are out there taking care of your rural communities. But, again, this is not the concentrated metro areas like Boston, guys. They're even targeting, this sort of rural, health disparity kind of thing. And it's just interesting to see where we are at in the current state of healthcare access when it comes to pharmacy. Because, healthcare access at the end of the day, I'll always beat that drum. And we're looking at where this is kind of just like getting a little ridiculous. And, these are frustrating, right? These residents think it's insensitive, outraged, looking at all this. And guys, getting my ad blocker off the screen. Excuse me. Just interesting commentary on this article. You got Reverend Minyard Culpepper here talking, what happens to our seniors and our single parents that have nowhere to get a Walgreens or another pharmacy anywhere near their homes, right? And we think it's so insensitive, it's unjust, right? Pointing to senior housing development just steps away from the Walgreens and questions how the elderly in the area will get the prescription medications without having to take public transportation, especially since the pharmacy chain closed their Hyde Park, Nubian Scare, and Mattapan locations in 2022. And right, as I just talked about, delivery is all fun and games until you need something today or now or, soon, right? And changes happen all the time, especially in the world where people take 13 medications, right? It's not just move to Jeff Bezos and Amazon or Mark Cuban or, mail order is going to save everybody's life. This is not how that works. Like, it's truly kind of healthcare that's just getting, cherry picked out of the system. And so, looking at that, can our country find some sort of better way out of that? Here in New Mexico, guys, we already know what we are. We are 14, 15, almost 15%, type 2 diabetic here in Doña Ana County. It's frustrating. We already know that, limited healthcare access and obviously a lot of government benefits, but easily tweakable, right? Your providers who are actually providing, independently from your big corporations, Walgreens, CVS. I'm talking independent pharmacy here, but at the same time, outside of your big hospital systems, outside of, your big medical care provider systems, your independent doctors are being almost chased out of the state just from higher insurance costs and higher liability and, no reimbursement rates. Like the medical billing industry, it's frustrating, guys. If, again, maybe you associate somebody with a white coat to just be loaded with money, but if you're really trying to operate a business, again, you're always waiting to get paid. You're never, unless it's a cash-based service, you're not going to get paid that day for those things. And if you're waiting on, government payers, you may be waiting anywhere from 14 to 60, 90 days to get paid back. And, it's just, again, a matter of spending that money or not spending that money. And when you're, the pharmacy, you're going to incur spending that money to purchase somebody's box of insulin for them, which the insurance reimburses you back less than what you paid for the insulin, thinking about the time that you spent to order it, to call the patient, to coordinate it, to get it ready, to do all those things. And then, wait 90 days to get paid back on that, just to be paid back, within 90% of it, and not even, you're losing 10% margins on that. Again, so it makes it hard for pharmacy industries to compete, hard to make a difference there, but it's doable, absolutely doable. Not anything by any means I'm running away from. I'm excited. I'm salivating for May 2024, baby. I'm getting right back at it, and we're going to be doing, my pharmacy and my vision, my way. I'm very, very excited to jump back into the game because, again, you have to play the game for what it is. And if you've got insurances that are doing things a certain way and you can only do so much, sure, you do so much. But at the same time, in that way, you can find different ways to take care of, communities, your people, and set up good systems to do it. So very exciting in terms of, on the entrepreneurial side, you look at big problems and you think solutions. In this case, the solution isn't, just going to mail order and taking people away. You got to keep people around. You got to get creative with it. So hopefully, our early part of first 2 quarters of this year show some positive light on the reimbursement side from the CMS contracts and the renewals with Medicare and the PBMs. But, this is just loaded, nerdy pharmacy lingo in our Pharmacist Frontline segment today, guys. But how does it get into a point? The people that are getting affected are those that are getting paid, or those that are, using services that are government funded. Those are the easiest ones to manipulate because big government contracts, you can go and suck up, big amounts of whatever you got to do. And these guys, CVS and Walgreens, act like they're, not hitting their record profits and things. But, when they're vertically and horizontally integrated and they can not only, make sure to give themselves the most preferable deals from the insurances that they own, to pay themselves back and reimburse themselves for the drugs that they get at an incredibly low cost and a low margin because, they can buy it at scale and or produce them in-house. It's like, truly David versus Goliath there if you're an independent trying to battle against that. But at the same time, just realizing that Goliath is, pretty much manipulating that system and, setting up everybody else up for just having to sit there and tread water while they can sit there and, maybe plan on bigger horizons to try to automate things 100% and get to robots and get out of people and do these things. But in the meantime, what happens? Pharmacy deserts, people are suffering. There's not quick answers. Independents, those who are taking care of people are getting chased out of communities because they cannot afford to service them because they are literally losing money to do that and spending time and good effort to do so just to compete against these guys who are chasing bigger profits elsewhere or preparing, investing R&D into the future, metaverse, all that stuff, right? But we're not there today and people are suffering. That's the problem. If it all worked and it was all going to be so awesome, Walgreens, then, don't forget about the now, right? Don't forget about the people in the entire country that are being screwed. So it'd be nice to see your big three find a way to reduce that burden on Americans, but I don't think it's going to happen. It's going to take pretty much competition to sit there and equalize it. Amazon, Walmart, Cuban, those are kind of different models there, but we'll see. A lot to think about there in the healthcare world, guys. Always be vigilant, that's for sure, when it comes to your health and your healthcare billing and everything you do there. Anyways, interesting stuff, guys. So Best Buy launching platform for prescription-based medical devices in our tech talk. I think it's cool because, where there's medical supply stores here in town and you look at the options from the medical supply stores, obviously that's awesome. But it's also cool to have one that might be open, maybe on a Sunday or whatever it might be, like Big Best Buy, that you can actually take your prescriptions, right, on their new platform of prescription health and wellness technology products, basically, and get medical supplies, guys. So you're looking at maybe wheelchairs or continuous glucose monitoring and some of these other things that you might be able to get from Best Buy here soon, covered by your insurance. So that's pretty cool stuff. Thinking of being able to shop, from the house and things like that. You don't always get, just comparing and contrasting, like your local guys, like always supporting local for sure. You just, get a little bit of a different amount of options when you're able to look at online and probably save some people some time. Not all your local people have their inventory online and very shoppable, or able to maybe even coordinate like the payments over the phone and things. Like you might have to come in, fill out a lot of forms, do a lot of things. And so I'm just curious to see as a pharmacist, like if you're going to recommend medical supplies, like where is Best Buy really going to fit in? I'm excited to see, maybe glucose monitoring, maybe, whatever it is going to be. And again, this is business that could and should be going to all your local medical supply stores, but may be more convenient and interesting to watch a different suite of medical supplies that might be out there and maybe even covered, right? I don't know what's standard covered or not. And like looking, down here on the Best Buy site, I don't know if their site is 100% updated for their new stuff, but says, can you get reimbursed for home health supplies? Many home healthcare products are expenditures that you may be able to cover with money from HSA or health savings account or flexible spending account, FSA. These accounts may be set up with an employer independently, depending on the type of account, allowing you to set aside untaxed money for healthcare expenses. Some common home medical equipment like blood pressure monitors, glucometers, pulse oximeters, and certain mobility devices might potentially be covered for reimbursement from these plans. Learn about the coverages right before purchasing items to make sure you can get reimbursed. This thing here, right? If you have Medicare, you may also be able to get reimbursed for some of the cost of those home health supplies, but you need that doctor's prescription. Of course, that's what they're now trying to roll out with Stripe for the device. And you also need to purchase it from a Medicare approved supplier. So it sounds like there's going to be some way that Best Buy gets wrapped into this contract, but until the meantime, and as always, make sure you understand all the requirements before things like choosing a wheelchair for sure, right? But I mean, if you've got Medicare or if you've got HSA and FSA and you don't have, maybe some of these medical devices current or up to date at home or things like that, it's very, interesting thing to consider going to go shop out there. From even Best Buy, right? Or at least use Best Buy as a central place to go and now be like, hey, well, whatever medical supply store that you're going to go shop, you can shop against it and price compare against it a little bit, because that price transparency and kind of just some of all that, it gets just so confusing in the medical supply world, just as much as prescription drugs, but it's its own thing for sure. All right, let's move on. So interesting stuff. The science of becoming a superhuman, guys. Seen a lot about the Wim Hof method lately, little different breathing techniques, meditation techniques, things as such. But, have you actually sat down and learned from the science of it and things before maybe going and signing up for the cool class that really, shows it, or doing the training that does it? Like, this was a cool science video that I like to explain the Wim Hof method for those of you looking at, exploring this type of meditation, breathing techniques, so on and so forth. All good stuff. It's just, man, it makes me laugh to think that I guess that we are selling things like introspection and breathing, selling the techniques for doing it, because we've somehow been slightly ripped away from them. And we're not really, we did not come out in cultures that, necessarily may have encouraged things like that in a lot of people. Maybe some people really were, right? But, a lot of Americans are, now paying to go and do these things and experiences, and totally cool, totally support it. Go learn how to do it, get in an environment where you can, see things. But check this out.
What are these people doing, and why am I showing you a bunch of lunatics performing some new age breathing techniques? Well, maybe they're not as crazy as you might think. In fact, these people happen to be performing something called the Wim Hof method. Today you will find out what they're doing, why they're doing it, who the crazy founder of this method is, how it works, and how you can start doing this yourself. Let's just start off with the introduction of this incredible, crazy, superhuman, lunatic man himself who founded this method. The man calls himself Wim Hof, and he's now known for more than 20 insane records worldwide. Did I say insane? Oh, good, because some of his records are running a marathon in sandals above the Arctic Circle while only wearing shorts, officially swimming 66 meters under ice with one single breath, hanging on one finger at an altitude of 2 kilometers, climbing the highest mountains on this earth in shorts, and running a full marathon in a desert without drinking water. Because of his achievements, Wim Hof has managed to get quite a large following in a very short period of time. So let's break it down. How does it work and what are the benefits? Here's how it works. You preferably do this the first thing in the morning, right after waking up. You either sit or lay in a comfortable position and you make sure that you can expand your lungs freely without feeling any constrictions. You now start doing 30 power breaths where you take deep breaths and breathe out through the mouth in short but powerful bursts. It doesn't matter if you breathe in through the nose or mouth, just get it in. After about 20 or so power breaths, you may start feeling symptoms such as lightheadedness or tingling sensations in the body. If you're not comfortable with this, then you can stop the breathing exercise early, if you please. After the power breaths, you want to take one last deep breath and breathe out all the air and hold your breath from this point on as long as you are comfortable with. You will notice that you can hold this breath for a much longer time than you normally would be able to. When you feel like you cannot hold your breath any longer, simply take one deep recovery breath and hold this breath for about 20 seconds and then breathe normally again. This is one set of the breathing exercise and you want to do about 2 or 3 sets. It's often recommended to recover a little bit between each set just to make sure that you feel good and okay. A bonus thing you can do would be to perform some type of physical exercise such as stretching or doing push-ups after breathing and while you're holding your breath. Make sure that you keep track on how long you can hold your breath, since it will be fun to track your progress and how much you're improving. Alright, here comes the shocker. The Wim Hof method involves exposing yourself to the cold after you have done the breathing exercises. So if you're new to cold exposure, then you can start off by ending your warm shower with 15 to 30 seconds of cold water and then gradually increasing your exposure. It's important to note that you should never practice the Wim Hof method while doing something that can put you or others in danger, such as while swimming, driving, or taking a bath. This is because there is a small chance that you will push yourself too hard and then lose control of your body. Okay, let's dig a little deeper to see what happens inside the body so that we can better understand just how amazing the benefits are. Let's start off with the breathing. Why is it important? Well, when you do the breathing exercise, you deplete carbon dioxide from your body and you supercharge your body with oxygen. This will make your blood's pH value go up, which will make you a lot more resistant to pain. Since we are depleting the carbon dioxide that is needed by our bodies in order to properly utilize oxygen, it will make our body have more oxygen, but it will be less available to the cells. This will trigger a fight or flight response in our body, which makes our body produce a bunch of hormones such as adrenaline and noradrenaline. This is absolutely nuts because it makes us able to control something that we should not be able to, which is the autonomic nervous system. What's even crazier is that people have been able to produce more adrenaline with the Wim Hof method than a person who's about to perform a bungee jump. The breath holding part is a crucial component because when we breathe out and we hold our breath, we are letting our body slowly build up the missing carbon dioxide again, which will...
So how do you make onboarding and training not suck? Use Trainual, the easiest way to train and grow.
But let's finish this.
So how do you make onboarding and training not suck? Use Trainual. The easiest way to train and grow your team is to save time training, streamline your systems and processes, connect your people and knowledge, keep everyone playing from the same playbook.
What I like.
Which will help our cells use the oxygen and bring us back to our normal state again. It is actually the carbon dioxide levels in our body that makes us want to breathe and not the oxygen. That is why a lot of people hyperventilate right before they dive into deep water, because they can then hold their breath for far longer. This is definitely not something that I recommend anyone doing, because there is always the potential risk of detecting the urge to breathe when it's too late. Now, because the oxygen is less available, your body will try to adapt to these low oxygen levels. That is, it will adapt you to environments where the air is low in oxygen, such as locations with high altitudes. This is why a group of people doing the Wim Hof method were capable of climbing mountains in record time without any prior training. People with no training would normally have to climb mountains over several days to get accustomed to the low oxygen levels and to prevent acute mountain sickness. But this was not as much of a problem for the people who performed the Wim Hof method. Okay, so the breathing part is good and stuff, but why on earth would I willingly take a cold shower? Well, cold exposure has actually been practiced for several thousands of years and has a bunch of benefits, but just to name a few, you will get stronger willpower, reduced stress, increased energy and alertness, increased testosterone and fertility, improved circulation, and much, much more. I could go on forever about the benefits of the Wim Hof method, but let's make this short. What can you expect from doing this? Well, trust me, you can definitely expect that it will wake you up. It will also strengthen your veins and arteries, give you a stronger and more effective immune system, give you a big boost in mood and mental focus, reduce inflammations, accelerate muscle recovery, boost your cardiovascular system, relieve or eliminate depression symptoms, and there seems to be promising scientific research of positive effects from people with autoimmune diseases and other illnesses. There is still much research to be done, but it's pretty obvious at this point that the Wim Hof method is here to stay and that it has some pretty significant positive effects on our bodies and our well-being. That's it for this video. Make sure you stick around by gently tapping that subscribe button, and I'll see you next time.
So, pretty cool stuff. Wim Hof, those who are waking up and doing breathing and exercises in the morning, if it even gets that much more targeted, these guys are able to go climb mountains and do some insane things, with Wim Hof methods there in the morning. And obviously the cold showers, there's something to that, mixing that with your right method of the, Wim Hof breathing and all those techniques, guys. Geez, some cool stuff. I cannot say I've vetted that or tried it myself, but, very interesting and something I kind of want to just give a try, right? Just to kind of be like, hey, well, what's this new thing? How is this, right? There's those Joe Rogan in the cold tub kind of, those are hilarious. He's got his they're funny memes, guys. I'm sorry for those of you who have or have not seen that. Joe Rogan, he's the GOAT. I get it. But him in that cold tub is something really, really cracks me up. Anyways, Herbal Wellness Corner brought to you by High Horse Cannabis Company, guys. Looking at cannabinoid extract in microdoses, ameliorating mnemonic and non-mnemonic Alzheimer's disease symptoms. Looking at this case report, relatively recent into last year, July 2022. It's just interesting because this report addresses a beneficial effect of cannabinoids in microdoses on improving memory and brain functions of a patient with mild stage Alzheimer's disease. The patient is a 75-year-old white man presenting with main symptoms of memory deficit, spatial and temporal disorientation, and limited daily activity. The experimental therapeutic intervention was carried out for 22 months with microdoses of cannabis containing cannabinoids, right? Anyways, looking at this, got some good data. And granted, this is one person, but patient, a 75-year-old white man of Italian descent, married with 3 children and 5 grandchildren, an autonomous farmer, countryside resident of Planalto, Paraná, Brazil, with city with roughly 14,000 people, where he participates in flea markets, church groups, and farming negotiations. He quit smoking 1 year before the start of the experimental treatment after 45 days of daily cigarette consumption. No history of alcohol overconsumption, but patient was healthy besides that overall. And it's just interesting to see because you're looking at that typical presentation of who's may actually be really in a beneficial period of their life to be using cannabis or learning from it, right? This is one of those situations. And this study was, again, assessing one person on a case study, but it still is a story, to consider and to understand, right? The neurologist here was able to get the patient off of memantine, and that's a, memory Alzheimer's based medication. And it's nice to see that, this THC CBD dosing, had actually some sort of efficacy for this man. And looking here is 500 micrograms of THC, right? Micrograms, that's half of a gram, right? For the initial 150 days, 0.75 micrograms of THC during the next 60 days, guys. In terms of how much does it take to cause a psychological effect with psychoactive effect with THC, you're looking at about 2.5 milligrams typically. So, for instance, 500 micrograms is about, 1/5 of a 200 or 2 milligram dose. So this guy's taking a very, very small dose as you're looking at that. So 500 micrograms THC for the initial 150 days, 750 micrograms THC for the next 60 days, 1 milligram THC for 30 days, and then 650 micrograms of THC on the following 30 days. Looking at that dose, fluctuated and was able to come up and then come back down and then back up again. 500 micrograms was the most used dose. And of note, the patient continues the extract at this dose without any additional drug of continuous use after the evaluation follow-up ended. So that was what he ended up finding, is find your dose. And that's pretty cool to just look at, finding your dose, starting low and going slow. This is like a true case study on all of that, guys. It's awesome. So, very, very, very awesome. And these Alzheimer's, scores and the quality of life scores and everything went up, and it's encouraging. It's one guy, one type of group, one certain history, but all you can ask for is, hey, let's attack it, right? Let's do something. Anyways, let's move on real quick to our community spotlight, brought to you by the Baked Chicken Farm. Shouting out, always love when our local places get national recognition, guys. This one's to La Posta De Mesilla. Historical place, going to get featured here on America's Best Restaurants. It's pretty awesome, guys. Later this month, they're going to be on the TV program. America's Best Restaurants came in, and basically they're going to be here January 26th. They're America's Best Restaurants Roadshow over here. So, awesome. Excited to see that. History of La Posta opened in 1939 under the ownership of Katie Griggs Quiñones. Jerry and Katie's great niece took over the business in 96 along with her husband, Tom. And so that's pretty cool, watching our local, community and business owners get that national attention. Always cool to see them get on a show and everything like that. Love the history, love the great food. Always want to be proud of those places in our community that really represent things like that. So for sure, guys. All right, let's get into the end of this. Men's Health Minute brought to you by Vado Speedway Park. Showing this Cleveland Clinic survey here, I think, we're really looking at the state of men's health in America. And I think it's interesting here. National Mention It campaign. It's from last September, but this new national survey, which is still relatively new, Mention It, highlights a disconnect between men's perception of their health and their actual health habits. And that's, important to see if you see the images to the side. In the survey, 81% of American men said they believe they are leading a healthy lifestyle. However, the survey results show the habits and behaviors of men tell a very different story. Almost half of men, 44%, do not get a yearly physical. 44% do not take care of their mental health. Only half of men say they keep a healthy diet, 51%. 83% have experienced stress in the last 6 months. Okay, that's fine, right? But still, what does that mean, in a compounding situation, right? About a quarter of U.S. men, 27%, watch TV for more than 5 hours per day on average. The survey, which was taken earlier this year by a national sample consisting of 1,000 U.S. males 18 and older, was issued as part of a Cleveland Clinic's 8th annual education campaign, Mention It. Right? So talking about it, mention it. Most men in the U.S. believe they're living a healthy lifestyle. 44% don't get a physical. 44% don't prioritize mental health. 49% don't keep a healthy diet. Looking at the little different things that you could be considering there, because it's easy to just go say, go to the doctor, obviously get your checkups like a car, right? Go get your regular scheduled things. But again, are you looking at all of kind of the holistic view, Over half of American men are not satisfied with their weight, yet 27% watch TV 5+ hours a day. 49% do not keep a healthy diet. On average, spend 2.3 hours daily on social media. So, survey finds stress being a common factor among men. However, 65% of men say they're hesitant to seek professional help for mental health concerns such as stress, anxiety, and depression. Social media habits may contribute to this, with men saying they spend 2.3 hours per day on average scrolling through social media. Those who say they are hesitant to seek professional help for mental health issues are almost twice as likely to spend 5 or more hours a day on social media. The survey also indicates that a significant portion of American men, 37%, have experienced issues related to sexual health. Despite experiencing issues, only 2 in 5 men who experience sexual health problems say they sought professional health. Now, we know there's a direct relationship between the men's physical, mental, and sexual health, said Georges Pascal Haber, doctor, right? MD, PhD, chair and department of urology at the Cleveland Clinic. A man's lifestyle and habits, whether positive or negative, can significantly impact his overall health. The first signs of many serious health conditions are often urinary or sexual issues, which many men are hesitant to address. Through the Mention It campaign, we want to emphasize the significance of being proactive with your health by getting regular screening, vaccinations, and exams to prevent health issues or identify them in curable stages. Other additional findings, guys, and then you're done with me. 54% of American men are not satisfied with their current weight, and 50% declare they are actively working on achieving their goal weight. Only about half, 56% of men realize that their drinking habits may affect sexual health, but even less, 43% are aware of the negative impact of smoking. 2/3, 65% of men have experienced issues having sex, say it made them feel frustrated. Money/finances is the number one stress factor affecting men in the U.S., indicated by 37% of respondents. What are you doing about that, right? Are you bettering yourself? Only about half of American men have been screened for common cancers, including prostate, colorectal, skin, testicular, and bladder. 2/3, 67% of men have performed skin self-examination. However, 83% of men do not use sunscreen on a daily basis. Moisturizer with sunscreen may be something that can be a little bit more, in a proactive approach there, keeping sunscreen. We've got the sun season coming up. We're not quite in there yet. I don't think many people are outside today, and if they are, they're probably covered up, but, still things to consider as we go about our daily lives, guys. And, other than that, we'll leave you to it. Hope everybody has a wonderful rest of their Thursday evening, January